lobotomy is a type of surgery involving the altering of nerve pathways in the brain. They are performed by using various instruments such as an ice pick to enter the brain and remove or create holes in areas of the brain associated with specific conditions such as schizophrenia and depression. The idea of brain surgery as a means of improving mental health began with the removal of dogs' temporal lobes to make them calmer and less aggressive. Antonio Egas Moniz of the University of Lisbon Medical School devised a technique involving drilling 2 small holes on either side of the forehead, inserting a special surgical knife, and severing the prefrontal cortex from the rest of the brain to resolve any mental problems. The lobotomy soon became a renowned miracle cure, but in actuality was nothing more than bad science. The science behind lobotomies stems from early animal testing, and, quote, operations on the brain itself for the purpose of relieving mental symptoms followed shortly upon the animal experiments reported, quote. With these experiments, it was determined that a variety of methods could change the mental states of patients, including using ethyl alcohol to disrupt neural tracts, using a leucotome to disrupt regions of the prefrontal cortex and thalamus, using an ice pick to enter the frontal lobe through the eye socket, and severing connections between the prefrontal cortex and thalamus. All of these methods were based on the belief that severing connections between certain aspects of the brain would alter their functions and thus cure certain mental and physical illnesses. The performance of the lobotomy first began with the development of the frontal lobotomy in 1935 by Dr. Almeida Lima and Dr. Antonio Egas Moniz, in which the white matter connections between the prefrontal cortex and the thalamus were sectioned to alleviate severe mental illness, including depression and schizophrenia. This is because these sections of the brain were thought to be responsible for these mental illnesses. Egas Moniz and his assistant completed nearly 40 lobotomies by 1937, and the procedure became standard practice. However, these surgeries still had mixed success. Frontal lobotomies were performed on patients with epilepsy, and seizure arrest was reported in 60% of the cases. This demonstrates the unsuccessful cases in certain areas of practice, but the progression of lobotomy usage despite the lack of results. While Moniz and Lima advocated for the lobotomy as a last resort, the doctor who paved the way for the lobotomy's mainstream popularity and normalized the procedure was Dr. Walter Freeman. He performed his first lobotomy in January of 1946. Freeman advertised the lobotomy as a solution or cure for mental illness, which is the main reason why it became popular. With the end of the Great Depression and the beginning of World War II, mental health became more prevalent of an issue, and everyone was desperate for relief to the extent that they were willing to try lobotomies as a cure. Other treatments like electroshock therapy and hydrotherapy were used, but they did not provide the relief that the general public was looking for. In the United States, about 50,000 patients were lobotomized, most of them between 1949 and 1956, which was just after World War II. Dr. Freeman himself performed between 3,500 and 5,000 of them. With the increasing realization that patients with mental illness should not be hospitalized except in extreme cases, the need for psychiatric drugs increased. However, many continued to go with improper treatment as these drugs and other treatments were not readily available. Psychotherapy, as proposed by neurologists like Sigmund Freud, was beyond the reach of most patients afflicted with psychiatric disorders until much later. Freud recommended psychotherapy, which was often ineffective and almost always unfeasible in severely mentally ill patients, in which diseases ranged from tertiary syphilis and severe anxiety neurosis to agitated depression and schizophrenia. It has been proposed that biased popular press coverage was one factor which stimulated interest in lobotomy, thus contributing to its widespread adoption. The press would misinform the public about how the procedure works and blatantly lie. In a Saturday Evening Post article called "Turning the Mind Inside Out," it stated the psychosurgeon cuts it at exactly the right angle in exactly the right plane, but the actual lobotomy procedure is relatively blind as the surgeon is largely unable to see the areas of brain being destroyed. The side effects of lobotomies covered a wide range of symptoms, including fever, vomiting, eye problems, bowel incontinence, agitation, decreased concentration, general indifference and passivity, seizures, changes in personality, and suicidal thoughts. Lobotomies disproportionately affected marginalized groups. Women made up 60% of all lobotomies. Other groups affected were people of color, especially African Americans, and LGBTQ+ identifying people, as homosexuality was considered a mental illness during this time.
In itself, very little preparation is necessary for transorbital lobotomy. This patient came to the hospital this morning after breakfast, and if all goes well, she will leave tomorrow afternoon. The operation can be done under any general anesthetic, but electroshock is preferred because of its familiarity to the psychiatrist. Transorbital lobotomy is performed during the stage of post-convulsive coma. The electrodes are applied and the first shock is given. The convulsion lasts about 40 seconds. When the patient shows signs of returning consciousness, a second convulsion is administered. Usually 3 successive convulsions are necessary, but in old people a single one may be sufficient, while in a sturdy young person 4 or even 6 convulsions may be administered without danger. The operation on the left side is seen from the profile view, which best illustrates the deep frontal cut.
A notable example of a failed lobotomy is the case of Rosemary Kennedy. Kennedy was born with intellectual disabilities and had a lobotomy at the age of 25. Her father had ordered a prefrontal lobotomy for her without her consent, further demonstrating the effect on marginalized groups. She suffered from seizures and mood swings soon after. It resulted in the inability to speak intelligibly and the stunt of her learning. By the end of the 1950s, lobotomies were banned globally. New and more ethical treatments were discovered. From the lobotomy arose a new procedure called deep brain stimulation. This neurosurgical procedure involved the placement of a neurostimulator which sent high-frequency electrical impulses through implanted electrodes deep in the brain to alleviate symptoms of mental disorders. Both of these procedures have been replaced with psychiatric drugs. These drugs treat a number of mental illnesses and disorders that were formerly thought to be cured by the lobotomy, and are much less invasive in doing so. Although these drugs have issues of their own, like accessibility and side effects, they were a much safer solution than lobotomies. There is a long journey ahead to finding equally accessible treatment for mental health, but anything is better than the bad science of lobotomies.